Welcome to BIV Today, the daily podcast from the Newsroom of Business in Vancouver. I'm Kirk LaPointe, publisher and editor-in-chief. My guest today has an important and profound story to tell about the intersection of business, mental health, and physical well-being. As a young child, Chris Gardner discovered his father's lifeless body. In those days, what he saw was termed an accident. It took years for him to assemble the information to determine, after he was told, that his father had taken his life, that he had suffered and succumbed to his mental health challenges. Today, for the first time, he's stepping up to discuss his story in order to spur an important public discussion of the issue. This week for the newspaper, I wrote what business has in the way of an obligation to lend a stronger voice in what has been a losing battle in the opioid crisis. And for too long, businesses have seen this issue as remote from their daily operations. And this is particularly true in the construction business, where many of these deaths occur. Chris Gardner is, of course, the president of the Independent Contractors and Businesses Association. The ICBA, launched 46 years ago today, in fact, is launching a workplace wellness program, an extensive, free of charge initiative for its members to discuss the mental health challenges for the construction industry. And Chris joins me now. Good to have you with us.
Good morning, Kurt. It's a real pleasure to be on your show this morning.
It's an important day for you and a very testing day, I'm sure. And so I'm going to be cautious here in all of this. So you can help guide me on what it is you want to discuss, to kind of walk us back to that day and the journey that you've had since then of discovery and revelation. What were you made to understand at the time?
Well, I was 5 years old, and it's a day that I will never forget, and it's hard to remove the images from your mind because they're so jarring, and the loss is so profound, not just for myself, but for the members, our immediate family. My father had two brothers and sisters and an extended family, so it was something that reverberates not only at that time, but through generations to this day. And so back then, as you indicated in your opening, it was an accident. And so it took a number of years, nearly a decade, for all the pieces to come together, and then for me to have a conversation with family members, where there was a discussion about the fact that my father had taken his own life. And it was at a time when people did not talk about issues related to mental wellness. And it was partly embarrassment. If people were going to come forward and say they were struggling in this area with mental health related challenges, the view would be there was something wrong with them. There could be repercussions socially, professionally. So things were very much swept under the carpet. And as we fast forward to today, that stigma around issues related to mental health is the biggest reason why individuals who are struggling and need help in a whole wide range of areas aren't getting the support and the help they need in many, many cases. And so we've got to be able to normalize these conversations to be able to ensure that people feel comfortable having a conversation and putting up their hand and saying, hey, I think I need to have a conversation. I think I need some help. And for people on the receiving end of that message to feel comfortable in that setting and saying, yeah, there are resources here to help, and giving them direction and some guidance about how to get the support that they need to get back on track.
Yeah, it's one of the curious issues involving all of this, as somebody who's had family that's had to deal with loss of life in this way, is that it's, for want of a better term, it's a really poorly kept secret. You understand the circumstance, but what happened in days past was that families were ostracized, and they were kind of kept separate. And as you put it, there was a stigma attached that would have huge repercussions on career, repercussions on social networks, repercussions all over the place. As a young child, though, what I wonder about in your case is what didn't make sense to you in the early stages of this? What, did you not apprehend there's something more here?
Well, when you go through something like this and you sort of consider all the circumstances, you start to ask questions. Well, why did this happen? Why was it like this? And it kind of does, when the explanations are, well, it was an accident. And you start to say, well, it couldn't have been an accident. If you put all the pieces together, this would have had to been some purpose, some deliberation, someone making a decision to end their own life in the way that he did in this case. So, young children tend to ask a lot of questions, and then as you get older, when I'm 5 years old and it's an accident, that's okay, fine. But when you're a teenager, you're more, your critical thinking abilities improve, and you start to ask more penetrating and deeper questions. So it very much was an accident. Now, that narrative I used for effectively the rest of my life. If people would ask me, how are your parents? I would say, well, my father passed away when I was 5. If they probed further, I would say it was an accident. And that's just partly a coping mechanism, but partly, it's a challenging situation and a profound loss that most people sort of keep hidden and aren't forthcoming about having conversations about. And certainly in his case, if I cast my mind back to what he was going through during the days, months, years leading up to that day, I think there would have been little or no support available, no resources available, no one to have a conversation with to say, hey, I'm struggling. And if people noticed the behavior, they would have been unlikely to ask a question that was in a meaningful way, and probably more inclined to say, hey, what's wrong with him? There's clearly, he's acting strangely, and he's not, maybe he's not part of the group. Those kinds of things that tend to isolate people and further compound the challenges of the struggles that someone is dealing with.
Yeah, and of course, it was a time of hyper masculinity, right?
Yeah, he was working for the Iron Ore Company of Canada. We were living in Labrador City in Wabush, which is it is very remote. At the time, it would have had 3,000 or 4,000 people in the town, and mining, like construction, like lots of different industries, certainly at that time, and continues to this day to be dominated primarily by a male workforce. And really the narrative is suck it up and work through that. Talking about something related to a mental wellness challenge or a psychological issue would have been clearly a sign of weakness, and something that wouldn't have been received very well. So people obviously didn't talk about it. And the challenge we now know today is that mental health challenges run very, very deep across our society, and they run very silent. And it's that silent that is extremely challenging, because when issues related to mental wellness surface, they can have devastating consequences for individuals, their families, and their communities and their workplaces. Now we're sort of much further along the curve in having open discussions today than we were 45 years ago. But there still is a stigma, there still is a reluctance to have these conversations. And programs associated with support resources for mental wellness challenges are usually an add-on to a health benefit plan. It's an afterthought. Right. It's not something that usually the focus is on, what's the dental coverage, how many massage or chiropractic visits are in the plan. There is an add-on that's often never even really addressed. It'll be, thrown out there as well. We have an employee assistance program. If you need it, here's a number. And that's pretty well the end of the conversation.
Yeah. Look, an important question I think that you can answer very well today has to do with how you feel and how maybe some of our viewers today would feel when you finally learn the truth. What is that? What happens then?
Well, I would say that there's two parts to that. One is I believe that I knew the answer. I was looking for confirmation.
Okay.
And really, it was a series of discussion with family members to say, this doesn't make any sense. How could this have happened in the way that you're saying it happened? And so I think it's something that you'll often hear words related to tragic incidents in people's lives, the word closure. And there never is closure. There never is a resolution. And I wrote an op-ed that's today for the launch of ICBA's new wellness program, where I say that there isn't a day that goes by where I don't think about this. And that's true. There is not a day. There's not a time. And everything will trigger memories of that day. Just normal things like someone saying, oh, it's my dad's 60th birthday, or we're going on a vacation with my parents, or it's Father's Day, or at Christmas we're going for dinner to my parents. My parents are coming over. All of those things were taken away on that day back in 1968. And that is something that you don't sort of, you can't put, closure around that. It reverberates through your immediate family, through your life every single day, and it's generational. And the consequences are devastating. And so there was lots of times when, if you think of the ways that the choices that an individual makes in their life, where, and it's incremental choices, and you can go down a path that's very dark and very deep and very hard to get out of. And I sometimes wake up and marvel that I in some way, shape, or form, I made good choices, and I didn't end up on a different path. I don't know why or how. I just did. And I'm fortunate that I had people around me who were supporting me. And I think that as I look back on it today, it's an event that shaped me in terms of who I am and how I view my life and how I interact with my colleagues and friends. But it was a profound loss that I feel to this day. And there's no closure. There will never, ever be closure.
My next question was actually going to be about how you feel it has shaped you, how it has conditioned you to perhaps be a very different leader than others might be.
Well, I think resilience, perseverance, hard work, all of those things come to mind because I took the view that I was alone. I was on my own effectively in so many ways, and that I had to make the best with the opportunities in front of me. And to do that, I didn't have a large family support network to fall back on. And so if I was going to move forward, I had to do it through resilience, hard work, perseverance. And I was committed to doing that. And I did. And I was fortunate I was able to go to Simon Fraser University, graduate with a Bachelor of Arts. I was accepted and graduated from UBC Law School. And but all of that was done with really just a singular focus in moving forward and not stopping. Because the fear is if I didn't work hard, if I didn't keep pushing forward, that the alternative was going to be a very dark and deep road. And so fortunately, through hard work and resilience, I was able to stay on track and then build the career that I've been able to build.
Well, you have taken a step, not back, but you kind of taken a pause here today to talk about this for the first time in your career, and it's obviously tied into the program that ICBA is producing. let me ask one last question about this, which is, what made you decide this was the time?
Well, if you think back to where we were, well, if you go back for the past, I would say, number of years, there's been an increasing focus on challenges related to mental health and mental wellness. And so as we came into the COVID-19 global pandemic, it was an issue that was starting to become at the front and center of a lot of important discussions. And then a year ago, exactly 12 months today, for the first time in the history in history, governments around the world in a synchronized way ask people to effectively stay home and do nothing. And if you think of that, around the world, every major capital, and you'll remember the pictures, the streets were empty. There was no people, there was no cars, very little was happening. And so what the global population has experienced is job losses, significant disruption and dislocation. Every single family celebration has been canceled: graduations, weddings, funerals, community events, sporting events, schools, universities, everything was taken away. And so the challenges we were experiencing with mental health and mental health and wellness issues were compounded as a result of the COVID-19 pandemic. So at ICBA, we were starting to look very hard at, we know this is an issue in the construction workforce. We've got to do something. And so we set ourselves and our team to task to work with experts, work with construction contractors, construction workers to develop the program that we have. And so as we came closer to the launch today, it really provided, to me, it was a little bit of a decision point. Mm-hmm. As a leader, as we launch what I think is an extremely important initiative, an important discussion in the construction sector, but also across our economy, what was I going to do? Was I going to share my story? To me, I felt like I cannot, on the one hand, say these discussions are important, but not be willing to sort of be more open and transparent about my own personal circumstances. So I thought about it for many weeks, talked to some colleagues here at our team, and I decided that I didn't want to take away from the story, but I thought that it was appropriate. I'm at a point where I think it's important. And so I made the decision to make that reference to my personal situation in the piece that we put out today.
Yeah, and it's of course people talk about the courage to step forward in all of this, and a lot of people are of course still probably watching, knowing what they know, but not really prepared to discuss it. Do you have advice for people right away about how you can do this, what it means when you do, and how not positive, but how important this is for people?
I think, and there's that's a complicated question because it operates in so many different levels. And I would say, just starting from the top, we have to normalize conversations around issues related to mental wellness, because they reveal themselves in so many different types of behaviors that are extremely negative and devastating to individuals, families, and communities. It can be addiction-related behaviors. It can be physical health, financial stresses, job performance, withdrawing from family and friends. There's a whole host of outcomes that stem from not having conversations, and these conversations are fundamentally important. The challenge that individuals have is people, and you use the term the courage to have these conversations, and I think I don't necessarily take the view that I'm being courageous, but it's difficult and it's hard, and courage may in fact be the right term, but I feel it's often overused because every family has a story. Every person is on a different journey. So I think the one thing I think is fundamentally important is that there are resources and there are help and there are supports. And I think we need to have those conversations. They need to be, people need to understand when others might be struggling, and have the confidence and to be able to say, hey, you see, like, is everything okay? You seem to be struggling a little bit in this area. What's going on? Can we help? And open that door to a conversation. And I think people who are personally experiencing challenges need to be assured that when they do put their hand up, when they do walk into someone's office or take someone aside on a job site and have a coffee and say, hey, I think I need some help, or I need to have a conversation with someone, that that's going to be positively received. Because if we don't have those, normalize this conversation, normalize this dialogue, the numbers that we're seeing, and you reported out on the challenges, the crisis that we're seeing in opioid overdoses, those numbers will continue to rise. And individuals and families will continue to be devastated. And we can't hide this, and we can't run away from the reality that is impacting all of us. And your lead-in was about the role that business leaders can play, because there is a deeply human dynamic to this, and there's an economic imperative, both in terms of the broader economy, but for individual businesses. You can't put together high-performing teams and expect those teams to perform if you're not willing to understand that there are going to be times, and this is one of them in the middle of a global pandemic, something we haven't seen for 100 years, that people are going to be stressed and challenged, frustrated, and they're going to need help. And as leaders, people have to be there to provide the support and resources to help people.
Yeah, I want to ask you some questions about your initiative, about the wellness program that you're going to be providing here. But I guess I should start by going back to an earlier part of our conversation where you talked about mental health services as being a bit of an add-on, an appendix to the physical health services that you get through your benefits plans and all that. Is it time for us to turn this on its head and start with the mental health issues and build upon them around the physical ones?
Yeah, so we have at ICBA, we offer, we are a very large provider of group health and retirement benefit plans. We have over 100,000 people who are on one of our plans. And in every single one of our plans, when we look at the numbers, drugs prescribed to deal with mental wellness are in the top 3 on every single plan. So I think now is the time to start having conversations, and we're doing that with our carriers, the big insurance providers, and with our clients, to say the programs that are packaged up as employee assistance programs need to be more robust from in terms of the services that the carriers provide, and also highlighted more in a more real and meaningful way to individuals who work for our clients and our customers. And so it's a 2-step process. It's what services are being offered by the carriers, and then ensuring that individuals understand what the resources are that are available and how to access them, and to feel confident that if they're struggling, the help is going to be there.
Yeah. The counseling services and the other services that are provided might appear to a business to be quite expensive on the surface of it, but it's a false economy, isn't it?
Well, yeah, and it's interesting because it actually isn't that expensive. I mean, it's probably somewhere around $1.25 per employee per month. So you're looking at $15 a year for a company to provide these types of employee assistance programs, and that comes with a suite of packages that provide counseling sessions and access to other experts and health professionals for free for the individual. So the cost is not as expensive as one might think, but I think there's more room to make those programs more meaningful and more robust, and to ensure that when they're delivered, so we package up the program and we say to our client, here's the health and wellness package, that we're working with them, and this is what we're committed to as part of our program, to make sure the communication to the individuals is comprehensive. It's done in a way that's meaningful to them. And there is a, if you scan the internet, there's a fair number of resources available for folks. But there's nothing out there in terms of what our research found that's tailored to the construction sector and to construction workers. So the language we use, the graphics, the topics we address are all geared towards construction professionals. In British Columbia, it's 250,000 men and women woke up today and went to a job site, accounting for about 10% of our economy. So it's a big group of workers who are often, I wouldn't say forgotten, but when folks in the head offices of some of these carriers who are developing these programs, the images and the graphics are generally going to be geared towards white collar professionals. People sitting around a boardroom table having a conversation, people going to a Pilates class, for example, not construction workers, working on a construction site, working with rebar, putting a roof on a structure, crane operators, mechanical or electrical contractors. It's a different world, different stresses, and the stresses for construction are a little unique. It's a project-driven business. So you start a project, and then it's going to end at some point. It could be 6 months, 12 months, 2 years. And then you move on to another project, which is a different job site, different team dynamics. So there's change there. Sometimes the work in construction's in remote locations. It's often defined by tight timelines. There's a schedule. We've got to finish it by this time. So if you've got a cold, work through it, a headache, the flu, whatever the challenge is, you just keep working. We've got to hit that. We've got to have this all done by Friday. And so there's not a lot of room there to have discussions around someone saying, oh, hey, I'm not, I'm struggling in a few different areas here, and I think I need some help. So we want to change that. It's about changing culture. And really at its core, our program is aimed at one thing, starting a conversation. We're not reinventing the wheel. It's really about having conversations on job sites with construction workers about the challenges that some people might be facing with mental wellness.
One of the things that I think stands out for the program, at least in my initial reading of it, is that unlike a fair number of programs where they're going to present you with a webinar and maybe a counseling session and perhaps a finite kind of engagement. This is protracted. You're providing basically a year-long journey on this one.
Yeah, it's designed to be a 12-month course, and so each month is a different topic. The first month will always be the stigma around mental wellness, and then all the other issues will flow from that. And there's an online component. It's not when I say it's an online component, everyone on the job site would go in at some point during that month for a few sessions that are 10 or 15 minutes long. But once you're in there, there's resources. You can interact with professionals. So if you are struggling, you have immediate access to someone who can say, okay, call this number or talk to this person. And it's meant to change culture. So it's not about saying, well, we're just going to have the people in the head office go through the program. It's about everybody in the company going through the program, whether you're in an office or on a job site. So the materials are specifically designed for the toolbox talk that starts every single morning on the construction site when crews get together and they say, okay, it's 5:36 in the morning. Here's what's going to happen on the site today, and they highlight some of the high-risk activities, or an incident may have happened. So there's a safety component to it. We want wellness to be part of toolbox talks in a way that people will relate to on the construction site. And so there's a lot of interesting material, strong visuals and graphics, and language and topics that make sense to construction workers.
A couple of last things, Chris. You talk about culture, construction culture. You've got 250,000 workers out there in the province, and the culture you wouldn't think instinctively is the one that you'd start with if you were looking at a province-wide program and all this. But do you have a sense yet of what success will look like for a program like this?
Well, we know that as we were talking to companies that we were involved in developing the content with, and companies who, individuals who serve on our board, um, the um, the level of enthusiasm was high. We think the uptake is going to be strong. In terms of measuring success, it's hard to say. I mean, what I would what the normal course would be that you would expect some of the larger companies with big safety teams and big administrative departments on HR to adopt this, and that's important that they do that. One of the things we're really trying to reach is the smaller contractor. 80% of our members have 20 employees or less. And those are companies where they don't have the big HR teams, the big safety teams, the big support networks. And we really designed the program to help those companies that don't often have those supports, to give them resources and materials that they can easily adopt and incorporate in their daily conversations with their employees and their teams. So I'm hoping to see a lot of companies in that space pick up on this program. And but listen, it's a little bit cliche to say, well, if you can change one person's life, it's been successful, because the consequences are so devastating for individuals, families, and communities that are impacted by this. When mental wellness related issues surface, it really is safe to say that if we can change lives, and maybe it's even just a small number of individuals who now put their hand up and say, I need some help. It's important. And it's not just about us. We're hoping that this conversation obviously is something that triggers similar types of programs in other sectors of our economy, with other groups, with other organizations and community associations and companies. It's really about all of us having these conversations together so that they're normal. And that's really will be a measure of success. So I think it works on lots of different levels, but that's my hope, that this is part of. There's lots of folks who've done a lot of work in this area before we launched our program. We're hoping to be part of that solution, part of the conversation, and hopefully others will join as we go forward.
Last question then. You're telling your story today. There's obviously this is a change in your life, in what you're discussing. This program today that's launched is a change in what ICBA is really going to do in terms of its leadership. Is this now for you, a really big purpose in your next chapter as a human being?
Yeah, I think that whatever you do professionally, if you're not going to make an emotional commitment to something, be passionate about it, to be able to drive something forward, you're not going to be successful. And for me, launching this program on the 46th anniversary of ICBA, in the context of my personal story, does certainly fuel a very strong desire to ensure that this program accomplishes a lot of the objectives we talked about today, and normalizing the conversation around mental wellness issues. So ensuring people are have the confidence to be able to put their hand up, ask for help without feeling embarrassed or scared. And for people generally, when they have colleagues who are struggling, to be able to reach out and say, hey, let's have a chat. So it has certainly refocused my mission, my vision for ICBA. And I'm excited about today and about what the future is going to bring as we engage with our members on this very, very important conversation.
Well, Chris, I really thank you so much for your candor today. And I know this is a challenging day for you, as they are for people who decide to start discussing in a more public way their stories, but an important story. And I feel privileged to have had the conversation with you, and I wish you all the best with this program.
Thank you very much. I really appreciated the opportunity to be on your program today to talk about this important issue, and look forward to staying in touch and having more conversations going forward.
You bet. Chris Gardner is the president of the Independent Contractors and Business Association. I'm Kirk LaPointe, publisher and editor-in-chief at Business in Vancouver. Thanks a lot for watching.